Hi, my name is Will Mary Rodriguez. This is my video presentation for Module 1 in Adult Health 2 with Aspen University and Professor Gardner. This week we did make a respiratory system, and we're just going to go ahead and talk about that. So here is my respiratory system model. I couldn't really get my lungs to be like full on straight, but it's fine. So I'm just going to go ahead and talk about this model from top to bottom, and then we'll move on from there. So starting with the straws, these represent the bronchi. The bronchi are two large tubes which carry air from the windpipe all the way down to your lungs. There are a left and a right bronchi which connect to its respective left and right lung. They are an important part of the respiratory system as they do distribute air to the lungs. They're also responsible for moisturizing and filtering the air that we breathe. This is through the help of cells within the bronchi. So there's goblet cells that secrete mucus, and then we also have ciliary, ciliary cells, which are like hair-like cells, which catch debris and bring it back up so we don't inhale that. Moving on down, we have our balloons. So these represent the lungs. So the lungs are the most important organ, one of the most important organs in our body. They take the oxygen that the bronchi deliver and trade that oxygen for carbon dioxide, known as waste. From there, the oxygen will be sent into our blood, which will then go to our body and oxygenate the rest of our body. The bottom portion here, this is our diaphragm. So this will help control our breathing. The diaphragm is a muscle and it does help you inhale and exhale. It sits right below the lungs and the heart, and it's attached to your sternum, the bottom of your rib cage, and the spine. So when you inhale, the diaphragm will contract and tighten, and it'll flatten, moving down towards the abdomen. This will create a vacuum in the chest, which allows the chest to get bigger and fill with air. When you breathe out, the diaphragm will relax and it'll curve back up towards the lungs. There, it will help push the air out. So now we did have a couple questions that we did have to answer. So the first question asked, why do some people have smaller or larger lung capacity? So the average lung capacity is roughly about 6 liters of oxygen. But there are different factors that exist that can alter one's total lung capacity. This would include age. So your total lung capacity will increase from your birth to your adolescence. But then once you hit about 25 years old, it'll plateau and it won't like increase or get any better. Another factor would be gender. So males do tend to have a larger total lung capacity than females. Body composition also is a good factor in total lung capacity, as taller people that are taller, they have a larger total lung capacity than those that are shorter. Ethnicity is also a good factor. So it has been found that people of European descent tend to have a larger total lung capacity than those of African descent. Other factors would include like physical activity, chest wall deformities, respiratory diseases. The next question was, how does asthma affect the lungs? So asthma is known as a condition that affects the bronchi, the airways. This asthma will create or it will make the airways swell up and narrow, and sometimes even produce like extra mucus. This will in turn make breathing a lot more difficult, and it'll trigger coughing, and you will hear wheezing when you auscultate respiratory sounds. You'll hear a lot of wheezing because the air is trying so hard to get into the airways and into the lungs. If you don't control your asthma, this will lead to lung or airway remodeling. This causes the lungs to become scarred. Asthma medications will no longer work as well, and then less air will be able to be moved into the bronchi to the lungs, which it's not good. So next question would be asthma. In regards to asthma exacerbation or an asthma attack, what are some priority things that you need to do. So the first thing would be monitor oxygenation status closely. You want to auscultate for lung sounds, and you also want to assess for any signs of respiratory distress. You would want to sit your patient upright, as sitting them upright will help for better breathing. And you want to administer your medications quickly. Medications would include your short acting beta agonists, such as albuterol. Those are your rescue medications. A nebulizer may have to be used, which will make the medication into mist, making it easier to inhale to the deeper part of your lungs. Oral corticosteroids may also help. This can reduce the inflammation in your lungs and get those asthma attack symptoms under control. If the attack is severe and you're finding that albuterol isn't helping, ipratropium can also be given. Asthma teaching points, you want to teach your patients to always keep their rescue inhaler on them at all times. You want to ensure that they know how to follow their asthma rescue plan or action plan. You want to recommend them getting vaccinated for the flu and pneumonia. You want to educate them on kind of trying to figure out what could possibly be triggering their asthma, so they can avoid that. And then you want to teach your patients how to monitor their breathing, and also educate them on the early signs of an asthma attack. So, the sooner you can get that under control, the better it'll be. And you also want to, just kind of educate them on the importance of taking their daily asthma medications, as that will help, avoid any asthma attacks. Community resources. There are many resources when I looked online that one with asthma can utilize. Three of the ones that I found was the Asthma Community Network, the American Lung Association, and the Asthma and Allergy Foundation of America. So now I'm just going to show you how this works. So once again, we have the bronchi, the lungs, and the diaphragm. So when you breathe in, let me try to get a good pinch. When you breathe in, your lungs will inflate, and then when you breathe out, they'll deflate. And so inhale, exhale, exhale. Awesome. All right, thank you.